Singapore Airlines is assisting both New Zealand and Singapore health authorities with a measles health alert. It's gathering the contact information of passengers sitting near an infected passenger for tracing and further investigations. The passenger, reported to be a 7-month-old baby, was travelling on flight SQ281 on Sunday. The baby's family had been in the Philippines for 6 weeks and had flown home to Auckland via Singapore, and the baby was admitted to the Waitakere Hospital on Monday and is reported to have been discharged today. New Zealand's Regional Public Health Service issued an alert after the baby tested positive for measles, and because the baby is thought to have been infectious while on the 10-hour flight, authorities are trying to track down the other 260 passengers who may have been exposed. So to tell us more about the issue is Associate Professor Lim Poh Lian from the Tan Tock Seng Hospital. So Professor, thank you very much for coming in today. Is there any cause for concern regarding the measles infection on board that flight?
Thank you, Yuan. Well, measles is highly infectious, but there is not that much cause for concern because most Singaporeans are protected from measles because of the National Childhood Immunization Program.
So once the airline manages to track down the other passengers on board the plane, what should they do?
Well, for most passengers, they should check their measles vaccination records. They may have to check their health booklets. And for those who don't have records of their vaccinations, then they may have to do a blood test to see if they're immune to measles.
All right, perhaps give us an idea of the difference between the symptoms of measles, the signs and symptoms between children and adults.
Well, children and adults are actually fairly similar, except that adults can get measles a little more severe.
Okay.
So the symptoms are primarily a high fever that can start about 7 to 21 days, usually 14 days after exposure. And then they get cough, runny nose, red eyes, conjunctivitis, as well as a rash. And the rash usually starts on the face and then spreads throughout the body.
All right, you mentioned earlier that it would be safe to assume that most Singaporeans would have been immunized very early on, so there shouldn't be a problem and we shouldn't be worried about it at all.
Well, actually, the important thing to recognize is that there are some Singaporeans who could be vulnerable.
Okay.
So infants under 12 months of age have not received their measles or their MMR vaccines. So those persons would be at risk. And there's also a group of Singaporeans who may have missed their vaccines, okay, perhaps in the middle age group, and then people who may have been born overseas or come from poorer backgrounds who did not get their vaccines.
So getting back to the measles infection, that 7-month-old baby was too young, or too young to be immunized. So what should parents be aware of if they're going to travel, especially with their infants? Should they just perhaps delay their plans if they're traveling with someone that's too young?
Yeah, if a child is traveling and is too young, I mean, it's a good idea to sort of delay travel plans. If someone is traveling to an area where there is an outbreak of measles and with a young child, then one option is to give measles even under the age of 1. You can give it at 9 months of age, for example, to a 9-month-old infant. But what's more important is that even if you're not traveling, that people around the child, the infant, caregivers, maids who may have grown up in overseas countries, they should, or grandparents should be getting vaccinated and have checked their vaccines that they're immune.
Okay, so in general, what are the statistics for measles in Singapore?
Well, measles had increased in 2011 to 143, whereas the year before in 2010, it was about 54 cases of measles, and that's in a population of about 5 million people. So in that year, following that, the Ministry of Health had changed the measles vaccination from the second dose of measles vaccine being given at P1 to infants at 18 months of age, babies at 18 months of age, to get measles number 2, MMR number 2.
Okay, so
the first dose is still given at 12 months of age.
Still at 12 months of age.
Yeah.
Okay, so doctor, one last question. Your advice for someone who is exposed to measles and is infected, what should they do immediately?
Well, most people with measles do all right, but some people with measles can get pneumonia or even a brain infection. Rarely, 1 in 2,000 may get a brain infection, maybe 1 in 20 to 1 in 100 get pneumonia. So if you feel very, very miserable and you're not getting better, then you may have to go see the doctor, and some people need admission to hospital. We just saw someone yesterday who just got back from the Philippines, and we confirmed the measles today.
All right, thank you very much.
32-year-old.
Yeah. Thank you very much, doctor. A pleasure speaking to you.
Thank you.
Yeah, and that was Dr. Lim from Tan Tock Seng Hospital on how you can be more careful and try to protect yourself from measles. Still on health.